Hey guys, today we're going to talk about drugs affecting the gastrointestinal motility. There are three types of drugs: the laxative, the GI stimulants, and the antidiarrheal drugs. Laxative are drugs used to stimulate movements along the GI tract and to aid bowel evacuation. This may be used to prevent or treat constipation. Also, the laxative or cathartic drugs can be classified into three: the chemical stimulants, the bulk stimulants, and the lubricants. Most of these agents are only minimally absorbed and exert the therapeutic effect directly to the GI tract. The adverse effects most commonly associated with the laxatives are the GI effects, such as the diarrhea, the abdominal cramping, and nausea. A very common adverse effect that is seen with frequent laxative use or laxative abuse is cathartic dependence. This reaction occurs when the patient uses laxative over a long period of time and the GI tract becomes dependent on the vigorous stimulation of laxative. Chemical stimulants directly stimulate the nerve plexus in the intestinal wall, causing increased movement of the stimulation of local reflexes. Aggressive laxative causes the fecal matter to increase in bulk. They increase the motility of the GI tract by increasing the fluid in the intestinal contents, which enlarges bulk, stimulates local stretch receptors, and activates local activity. These drugs are all taken orally. They are directly effective within the GI tract and are not generally absorbed systematically. And next are lubricants. These are the type of laxative recommended depend on the condition of the patient. The speed of relief is needed, and the possible implications of various adverse effects. These drugs are not absorbed systematically and are excreted in feces. The adverse effects most commonly associated with the lubricant laxatives are GI effects such as diarrhea, abdominal cramping, and nausea. Next are the gastrointestinal stimulants. These drugs stimulate parasympathetic activity or make the GI tissues more sensitive to parasympathetic activity. GI stimulants should not be used in patients with a history of allergy to any of these drugs to prevent hypersensitivity reactions or with any GI obstruction or perforation, which could be exacerbated by the GI stimulation. The most common adverse effects seen in the GI stimulants include also the nausea, vomiting, diarrhea, intestinal spasm, and cramping. Lastly, the antidiarrheal drugs. Antidiarrheal drugs are used to soothe the irritation in the intestinal wall, block the GI stimulant activity to decrease the movement, or the effect of the CNS activity to cause GI spasm and to stop movement. Antidiarrheal agents slow the motility of the GI tract through direct action on the lining of the GI tract to inhibit local reflexes, called bismuth subsalicylate. Bismuth subsalicylate is absorbed from the GI tract after oral administration, metabolized in the liver, and excreted in urine. So those are the drugs that might affect our gastrointestinal motility. Bye!